Hi there, it's April Lee. It has been a while, probably close to a year. I just wanted to check in and say hello. If you are new to the videos, that I'm still going to make more videos. It's just been a while because of the things that I have been going through with my health. I've just not had the energy um, or the mental energy or clarity to create a video that I felt was worthwhile. So don't mind my messy stuff. I'm cleaning out a closet slowly, but it's getting there. Anyway, I wanted to just check in and say hi and do a quick summary update of what has been going on. As of December 22nd, 2025, no, December 22nd, 2024, I shut my business down. I was a hairstylist for close to 24 years, if you count like starting school and then assisting and all of that. And I just couldn't do it anymore, mentally or physically, because of my health. And I was already down to like barely working at all, like 9 hours a week. And it was killing me. Unfortunately, and I absolutely loved it. It's been a big change, but it's been what I needed to do. So it's been a year, and it took a good year to not be working in order to even get to where I am right now, which is not cured, it's not healed, but I'm able to pace better and listen to my body and what it needs, and take better care of myself. Since I've last been on here, I was having a lot of problems still, no answers, and a doctor that I have is a cardiologist of all things. She looked at my history, and she didn't have to do that, but I didn't ask her anything. She looked at my history and she went through it, and like 13 years of medical documentation and everything, and realized that she believed I had dysautonomia, which I always thought that fibromyalgia and dysautonomia were the same thing, but they really are not. Fibromyalgia, from what I've learned and what I've dealt with, is just whether it's a condition on its own or just a label of symptoms, it's mostly muscular pain, and that is what the fibromyalgia part of my health has caused. Obviously with that you get brain fog and a list of other things, many things, but I was getting extra things and having a lot of symptoms with my vitals, like heart rate and blood pressure and oxygen and everything. And that really started after COVID, if you know what I'm saying. And that was in started to have mild symptoms, and then it got really bad. But that started in 2021. So I was originally diagnosed with fibromyalgia, chronic migraines, central sensitization, and chronic fatigue syndrome from Mayo Clinic in 2020, after having years of symptoms. And then 2021, or around then, got COVID, then long COVID, and it refueled everything, and then somehow developed into mast cell activation syndrome, which I had to fight for those answers, but I finally got that diagnosis. And by getting a diagnosis, it's not to make a list of symptoms and say, woe is me. It is to have knowledge of what is happening to your body, so maybe you can possibly find the root and fix it, or at least know what is going on so you can treat accordingly and take better care of yourself, not to worsen. So that was a fight, but I got that diagnosed and treated, and I'm on treatment for that. I take Xolair injections. That helps that condition the most, and there's a whole bunch of things that you can do for that, but this would take too long, so I'm just going to kind of summarize things. So then after the heart doctor said, I think you need to go to specialist, get dysautonomia checked out, whatever, so I went to a specialist. It's very hard to find them, but I found one that she recommended with UCF Health in Orlando. Amazing doctor. On a side note, he is leaving and going to somewhere in New York, probably a major college or something like that. I can still see him. I pay out of pocket. It would be virtual, but he could oversee my care. I'm not sure what I'm going to do, but that's an option. Anyway, so I went there. They looked at years of history. They did many tests. Now the thing is before I saw him, she put me on a heart monitor, like a 21-day heart monitor, and that ended up catching all the things I was describing. And the time of everything was with my symptoms, because as you feel things and you're with this heart monitor, you click a button and it tracks like, I guess like the episodes, so to speak. And then you can keep track in a little log or whatever, and then explain things with your doctor. So I did that, and it showed that I had tachycardia, which is basically just like irregular heart rate. And then my blood pressure was really high, and it was really low. My oxygen was like dropping into the 80s. It was all over the place. Nothing was steady. So after that, she sent all that information to that doctor. I went to that doctor. They did a, I can't remember the name. Sorry, I'm like itchy in my throat. I can't remember the name of the testing, but they did it. It's basically like a tilt table test without the tilt table test. So they check your heart rate and your blood pressure and your vitals and everything as you lie down and stand up and sit and all this stuff in a specific pattern. And by doing that and tracking my symptoms along with all of my stuff being ruled out and all the other testing that I did, they were able to diagnose POTS, which is the postural orthostatic tachycardia syndrome, and IST, which is inappropriate sinus tachycardia, which is what was tracked on the heart monitor, and then generalized like dysautonomia based on my symptoms. So I basically came in there with months and months and months of like daily symptoms that I just had to track, so they can kind of get like I guess like a picture of what's going on. And based on all of that, they were able to basically say you're classic for all these things. So by doing that, that doctor was able to help me with the basics, you know, like compression and salt and electrolytes and when to take them and how to do it and all this kind of stuff, and positional things, and eventually try to get into exercise with recumbent positioning, you know, with a bike and stuff like that, and then other things. And we tried the beta blockers. All they did was cause extreme swelling and water weight gain within like a week or so, and some other things. What has helped me the most is a medicine that I researched on my own. It is called guancifene. I don't remember the spelling, but I will find it and I will link it in the bottom. Now, this medication is off-label for dysautonomia and POTS patients. Also, it is known to treat, it's a non-stimulant form of medication for ADHD. Now, after going through all this and being treated for a year, and going from like severe POTS to being able to at least like manage my symptoms, and because knowing what you have, you can help it, right? So I've done everything I can between diet and exercise and not working and everything possible. By doing that, I was able to treat the best I can and maintain and hopefully one day get better. I don't know yet. I'm working on that. But in the meantime, I've had a lot of cognitive issues. And I've pretty much known my whole life that I had a form of ADHD or something. It gets really bad. It's so bad that your mind races so quickly that you know there's thoughts happening, but it is so quick, you don't even know what the thoughts are. It's so fast. And so it makes me very unproductive, and it's a struggle to function correctly, especially when you're tired, you have brain fog from all your conditions, and you deal with so many other health issues. So I decided, you know what, let me talk to my primary care. They don't know much about guancifene, right? So after that, I called my POTS doctor, and we had an appointment anyway. And he said, you know what, it's off label for POTS. Let's go ahead and try it and see how you do. And if it starts to treat your brain fog and the focus a little bit, then you should look into getting a official diagnosis of the ADHD so you could address that. So that's what happened. I got on 1 milligram of the medicine. The clarity started to come back. I still get brain fog. I still have another issue. I'll get to that in a minute. But it helps a lot, like a whole lot. And then what I did is I ended up going to, after being on it about 2 months, I went to a mental health doctor, psychologist, to get evaluated for ADHD, which they did confirm and diagnose that. And they said the reason that the medicine is working for all of it is because it treats all of the things that you deal with, right? So they took me from 1 milligram of where it like wore off after a certain amount of time to an extended release. I take it in the evening. It's supposed to help you sleep and then slowly release throughout the whole day. So by the time you take the next pill, it's still working. So you don't just like fall off the cliff of focus, right? So I can't take stimulants because they make me crazy. I can't do anything. I'm like wild. And my heart races and everything. It's not good for my health anyway. So this medicine is great, thank God. But in the meantime, I thought I had a hearing issue. Come to find out after getting testing that everything's fine with that. My hearing is amazing. It is a processing issue. Even the mental health doctor said that, yes, I agree with the ENT doctor and myself that you need to go get evaluated for, what's it called? Auditory processing disorder. In addition to my primary care wants me to get mixed in with that is central autonomic, I don't know, processing issue, whatever. So I think that stuff I know has come along with the health issues. So I would like to get that evaluated and checked out because there are therapies and treatments for that. And I've been doing some really crazy things where I was going down a few steps, and I don't normally take stairs because when I go upstairs, like up steps, I get winded so easily because of the like fluctuation of heart rate. So I try not to do that. I can walk straight, but just going up steps is hard. So going down the steps, I got stuck halfway through the steps and forgot how to get down the steps. And I had to stand there and just kind of like think about it and pick up my legs and force myself down the steps. It's just weird things like that. And I'm constantly asking my family to repeat themselves. And it's not because I can't hear them like I thought. It's because I'm not processing as quickly as they are speaking to me. And I'm like, it's weird because I'll be asking them, I'm like, to repeat themselves, but halfway through me asking, I'm starting to like grasp at what they said. So it's just really weird. It makes me feel very slow and stupid. And I'm not slow or stupid. And I definitely don't want to get weakening or worsening of my mental health as far as memory, because I already have brain fog, memory issues, and stuff like that. I do notice that on the medicine, on the guancifene, before I took it, I was having a very big issue with forgetting like everything I was doing. So I would like place something somewhere and 2 seconds later I'm like, where is that? I don't remember even like moving it or what I did. Like the short-term memory was like barely there. And I would go to move something, and if my husband was in the room, I'm like, why'd you put that there? What are you doing? Why'd you do that? And he's like, I didn't, you just did that. So I don't know if I'm out of a flare of maybe inflammation or something funky with my cognitive issues, or if it's the medicine helping that as well. Not sure. But so these are the new things added in. I'm hoping that I'm not just accumulating a book of illnesses, but I'm kind of getting a picture put together so I can gain better control of how I'm feeling and progression to slow things down. And hopefully be able to exercise and incorporate that without crashing, because I get very excited. I bought a used total gym, because it's on these inclines, so you can work out recumbent, like you're in different angles, but you're never straight up or standing. And I was okay. And then I decided, wow, that's great. Let me try 3 days a week after like a week of just a little bit. And I crashed really hard. I mean, so hard that I drove my daughter to school. I had to force myself to do that. And I came home and like passed out for like 4 hours and could barely function mentally or physically for a couple of days. So that is not a goal. And I'm going to have to slow down, because my doctor worked with me on that and is explaining what to do. I also had a surgery. It's been about 3 months. And that's why this thing is here. It's a scar patch or whatever. I had surgery for it's a cervical disc replacement, and I did very well with the surgery. They cut here, they went in. I worked with a vocal, not a vocal coach, a vocal doctor, like a doctor that deals with like the head and neck and the throat. And they did a full evaluation to make sure my vocal cords are good, everything's good to go. Then I had a neurosurgeon work with me for over a year. So he sent me to all this therapy first, every procedure possible. Nothing did anything. And so he decided, yes, this would benefit you. So I had it done. I did well in recovery. I worked with all of my doctors to make sure that I didn't flare up too bad in all the other areas of issues that I have. And so far, so good. I love to sing. It's like me and my way of like communicating with the Lord besides talking. I absolutely love worship. And I'm getting back into it slowly, but I noticed that my lower register, which was almost gone in the beginning, because your throat and everything, like all the muscles are healing and like strengthening up, and some are tight and some are, it's just crazy how you're healing. But I used to get a lot of pain in the back of my neck when I would sing and talk, and that has dulled down a lot. So like as I'm talking, I get a lot of tension, kind of like muscular tension and stuff in my neck, but not as bad as I did before the surgery. So I'm very hopeful, and like, I don't know, I'm really giving myself like a good year from even now to be able to fully have my longevity of speaking back, and my full range of vocal ability to sing, because I love it. Whether I ever share it again or like do something with that, I don't know. But I love it for myself, whether I sing at church or I don't or whatever. I just miss it. And I'm very grateful to be able to sing, because it's like therapy for me. It also is calming of the nervous system and everything. So I'm really hopeful that I get the full range back, and maybe even more. But that's the only thing I'm dealing with right now is, and it's not as bad as it was, because in the beginning I couldn't even like sing low notes. So now I have the low notes and the mid-range notes without any pain or tightness. But when I go up, it's almost like I'm getting restriction in that area. So I'm really hopeful that I'm just gonna sing low, and as things heal and get better, that I can go higher without causing any issues. Anyway, so that's something that I love, so I really hope to get that back. And yeah, so that's kind of where I'm at with everything. I wanted to give an update and let you know that there's a lot that I've been going through and experimenting with and trying and taking and diagnosing and all of that. So if you guys have any questions about any of these things, if you want a video on it, or you're curious about things, I can make a video on the cervical disc replacement. Forgot the initials for that, but it's artificial cervical disc replacement. And I had there's three it was like from 5 to 7 or something like that, but I had another area that could have been done, but like with insurance and stuff, they don't want to do all that. So I just did what was most important and was like covered. So I had that done, and I can talk about that. I have the POTS information, the inappropriate sinus tachycardia, the dysautonomia, all that, if you want to talk about that or the process. And I also with the mast cell activation stuff, and then also ADHD, and then this whole processing disorder stuff. I'm in the process of insurances having to like approve a special place because hardly anyone does the testing or the treatment or anything for this stuff that's not out of pocket. So hopefully that'll get all cleared up and covered, and I can figure out if I have it or not. I'm almost hopeful that I do, because if not, then I'm kind of afraid of where my memory is going. So I really hope that all three doctors believing that's the issue is the issue, so I can fix the issue. Anyway, so that's where I'm at. If you are new here, hey, how you doing? Thank you for stopping by, and God bless you. Bye.